Okay, ready? Hi, I'm Cindy. I'm going to be your nurse practitioner student today, and I am from Seattle Pacific University, and today I'm going to be doing a head-to-toe assessment on you. If anything hurts or if you have any pain, please let me know. So the first thing I'm going to be doing is I'm going to be observing the patient's overall health and mental status. She appears to be well groomed, and it appears to be no mental distress. Physical distress. Okay, the first thing one of the things that I'm going to be doing throughout the examination is I'm going to be assessing her skin, and I'm going to be assessing that for the moisture, temperature, color, trigger, any scars, any lesions, any hair distribution, color changes. All right, so the first thing I'm going to do, Sophie, is I'm going to have you hold out your hands like this, and I'm going to be assessing her hands, looking for any bony abnormalities, looking for any rashes or anything on her hands. Any pain there? Next, I'm going to be checking her cap refill, BRIS to 3+. And now I want you to go ahead and do this for me, Sophie. Good, so I'm checking for clubbing and negative for clubbing. All right, so the next thing I'm going to go on to is I'm going to feel for her radial pulses. I'm feeling for rate, rhythm, symmetry, and amplitude. So 72, 2+ out of 4. Rhythm is right, and they are symmetrical. Next, I'm going to go on to palpating her wrist, any tenderness. I'm going to be palpating up her arm, looking for any redness, tenderness, bony abnormalities, stopping at the olecranon, any pain there. Going all the way up to the glenohumeral joint. Good. Sophie, come on. Sophie, I'm being timed. Next, we're going to go onto this side, going up the wrist, up the arm, to the olecranon. Again, moving up, no deformities, no rashes, going onto the shoulder, the glenohumeral joint. So, Sophie, now we're going to do some exercises, all right, some flexion exercises. So I'm going to have you stick your hands out like this. I'm going to have you flex, extend. I'm going to have you supinate and pronate. Good. I forgot to have you grip my fingers here. Can you go ahead and grip for strength? Great. So strength is 5 out of 5. Now we're going to go on to doing some shoulder range of motion. I am going to, so follow my movements. I'm going to have you extend. I'm going to have you cross your hands over for adduction, have you bring them out that way for abduction. I am going to have you put them behind your back for internal rotation, looking at the level of her hands, and then bringing those up behind your head for external rotation. And again, looking at that. So good full range of motion of the shoulders. Now we're going to do strengths. So the first thing I'm going to have you do is hold your hands out like this. I'm going to press and resist against me. Okay, good. So that is bicep strength. Now push down against me. Good. Tricep strength. Both of those are 5 out of 5. And arms out like this, and we're going to test deltoid. Good. So deltoid 5 out of 5. So the next thing that we're going to be going on to, Sophie, is I'm going to be looking at your hair. I'm looking at your hair pattern distribution, looking for any infestation, any rashes. I don't see any of those. Now we're going to be going on to your eyes. Do you wear glasses or contacts?
No.
No, okay. So let's see. Here I'm going to be looking for any lid lag. I'm going to be looking for any exophthalmos. I'm also looking for any edema. Here I am going to do some little exercises for you. First, we're going to test the cranial nerve 3 oculomotor, 4 trochlear, and 6 abducis. I'm going to have you just watch my finger here, okay? Just with your eyes, move your eyes. Here I'm looking for any nystagmus. Let's just like this. Again, okay, so no nystagmus noted. Now we're going to check for accommodation. Here I'm going to have you look here at the end of my pen, and I'm going to have you look out against the wall. Good. Back here and back out there. Good. So accommodation is intact. So when she looked at the pin close up, her pupils constricted, and far away, they dilated. Now I am going to go on to
Pupillary response?
Okay.
You need to say that, I'm testing pupillary response.
No, pupillary response is another one. Okay, but I need to do that now. Okay. So the next thing we're going to do is pupillary response. Here I'm going to first look at your eyes. I'm going to be assessing the sclera and the conjunctiva. Go ahead and look up for me. Look side to side and down. Good. Going to do the other side, up, down, side to side. Good. So sclera is, or conjunctiva is clear, sclera is white. Now I'm going to be looking at your pupils. This is cranial nerve 2 and 2, optic and 3 ocular motor. Is that correct?
Yeah.
Okay, so here I'm gonna look at your pupil. Whoops. Good for direct. Good for direct. And now we're gonna do consensual. Good, okay, good. So cranial nerve 2 and 3 are intact. Her pupils are about 4 millimeters. They are round and equal. Next, I am going to be looking at the back of your eye with my with the fundoscopic exam. So with this, Sophie, I'm going to have you look out straight behind me, okay? And then this light is going to be shining in your eye, okay? So first what I'm looking for is the red reflex going in. Good. I'm going to go to the other side again. Looking for that red reflex going in. Good. So here I was able to visualize on both sides. I was able to visualize the disc, which was orange in color. It was well defined. There was no AV nicking, no lesions, no hemorrhages. Is that all you need?
Disc margins.
Disc margins are clear.
Are sharp.
Sharp.
And well defined.
And well defined. Sharp and well defined.
Did you comment on the red reflex?
Yes, and the presence for the red reflex. All right, so now I am, okay, so I've done that. Okay, so now, Sophie, we're gonna go on to the next test. Do you have any problems hearing?
No.
All right, so I'm gonna go ahead and have you plug this ear here, and I'm gonna whisper something to you, and I want you to say it back, okay?
Seattle.
Good. Plug this ear. Gonna do it on this side.
Baseball.
Baseball. Okay, so the patient was able to repeat the whispered words. So that is the acoustic cranial nerve 8 intact. Next, Sophie, I need to just
Vestibular.
Baby.
vestibular.
Vestibular.
Here, okay, that's yeah. Now I need to say that. Okay, so Sophie, now I'm going to just feel your ears here. Any pain? No pain. Okay, shouldn't have this in my hand, but I did. Okay, so I should put this down. Okay, so no pain. So the tragus and the auricle of the ear, no redness, no tenderness. Now I'm going to go ahead and look in your ears. Okay, so I need you to hold your head nice and still. Still, I'm going to be using 3-point bracing, looking in the ear. Okay, for the first ear, I'm able to visualize the tympanic membrane, which is pearly gray, minimal cerumen. I saw the cone of light, the bony landmarks were present, and okay, that was it. Okay, now we're gonna go ahead and do this one. Oh my God, so we need to clean your ears. Holy shit, oh girl.
Did.
All right, so on this ear again, I was able to visualize the coney light, the cone of light, the tympanic membrane was pearly gray. There was no redness, minimum cerumen, and bony prominence, cone of light, tympanic membrane was pearly gray.
Up here it says, inspect for redness or swelling and palpate for tenderness or pain.
Okay, did that first. Okay, so that was the first part that you did the tragus and the auricle. Okay, so good. So Sophie, now we're going to go on to the next part. This I'm going to actually be inserting in your nose to look up your nose, okay? I'm going to have you tip your head up for me. Good. go to the other side. Okay, so with the nose, I was able to see the the septum, which was midline, non-deviated. There was no intact. There was no polyps. The mucosa was pink. The turbinates were non-boggy bilaterally. All right, do you have any problem smelling coffee?
No.
All right, so that is indication that your olfactory cranial nerve 1 is intact. Okay, cranial nerve 1 intact. Okay, so now, Sophie, okay, I've done your ears, I've done your nose. Now we're gonna go to your mouth, okay? So here we're gonna pretend like I have a tongue blade. I'm gonna have you open your mouth. I'm gonna be looking in your mouth. Good, lift up your tongue for me, good. I'm looking for any dental caries. I see no dental caries. I see no lesions. I see no blocked ducts, no leukoplakia. Okay. So that, next we're gonna go on to cranial nerve 10, vagus. I'm gonna go ahead and have you open up, stick your tongue out and say, ah, good. So I was able to see the uvula that was midline, the soft palate rose and fell with phonation, indicating that cranial nerve 10, vagus is intact. Have you had any changes in the taste of food recently?
No.
Okay, so that indicates that the cranial nerve 7 facial and the hypoglossal cranial nerve 9, is it hypoglossal? No.
10 is vagus.
No, I'm at 7 and I'm at 9, which is the uvula, or hypoglossal.
No, hypoglossal is 12.
So the glossal pharyngeal and the facial nerve 7 is intact.
Facial and glossal.
Glossal pharyngeal. Okay, so I was able to look at both of those. So now, Sophie, I need to go ahead and palpate your tongue and your lips and your mouth. Okay, so feeling, sticking my finger in, feeling, palpating. Okay, good. I don't want to get my glove dirty because I need to use it on other people. So I was able to palpate the mouth, no lumps, no lesions on the lips, no lesions inside the mouth, no lumps, no, what else?
Ulcers.
No ulcers.
Dental caries.
No dental caries. And, okay, like this for me, sweetie? Okay, no overbite. All right, so now we're gonna go on to the facial nerve, which is cranial nerve 7. No, I wanna do cranial nerve 5 first. That is trigeminal. So here, Sophie, I'm gonna be feeling your temporal area. Go ahead and clench your jaw for me. Good, nice and strong, 5 out of 5 muscle there. Go ahead and open and close your mouth. Good, again. Here in the tympanic, or the TM area, no clicking, no audible clicking, no crepitus. Muscle was strong, and that is cranial nerve 5, trigeminal intact. Now we're going to go on to cranial nerve 7. Cranial nerve 7 is the facial nerve. So let's go ahead and have you raise your eyebrows. Good. Close your eyes for me. Go ahead and resist. Good, 5 out of 5 on muscle strength there. Go ahead and smile. Show your big teeth. Okay, go ahead and frown for mom and puff out your cheeks. Good job. Okay, so cranial nerve 7 is intact. Next, we're going to go on to cranial nerve 11, which is the spinal accessory. So go ahead and shrug your shoulders up against me. Try to resist me. Good. So the trapezius, 5 out of 5. Go ahead and push against my cheek, my hand here with your cheek, my other hand with your other cheek. That is the sternomastoid muscle. Again, that is 5 out of 5 both sides. Now we're going to go on bilaterally. Yes, bilaterally. I need to use terms. Okay, so next we're going to go on to, did I do 12? No, hypoglossal.
Yeah,
Okay, hypoglossal, cranial nerve 12. Sophie, I'm going to have you stick out your tongue for me. Good, and I'm going to have you move it side to side. So tongue was midline, what's it called? Tongue was midline without deviation, and she was able to have full range of motion. So cranial nerve 12, the hypoglossal intact. All right, so Now I am going to go on to your lymph nodes because I always forget these. So, and that might be in the next section, is it? Okay. So Sophie, I'm going to be palpating your lymph nodes, pre-auricular, using a circular motion, post-auricular, the occipital, good, tonsillar, submandibular, walking up to the submental. Gonna do the cervical, deep cervical chain, posterior cervical, and then going on to the, just relax, supraclavicular, infraclavicular, and then I'm gonna go into the central axillary node. So this is under your arm, so this might be a little bit painful. Swooping up, pushing down, good. Gonna go on to the other side. Swooping up, just relax, swooping up, pushing down. All right, so no palpable lymph nodes, none greater than 1 millimeter, no hard or firm, and no any pain when I palpated any of your lymph nodes, no pain. All right, so now we're going to go on to
there's no lymph
edema,
lymphnopathy appreciated.
Lymphadenopathy appreciated. Okay, so now, Sophie, we're going to go on to some range of motion of your neck. I'm going to have you follow me. Bend your head down, touching your chin to your chest. Good. So good flexion. Look way up into the sky. Good extension. And then I'm going to have you rotate from side to side. Good rotation. Now we're going to do lateral rotation. So ear to shoulder, ear to shoulder. So full range of motion of the neck.
Flexion extension?
What?
Did you say flexion extension at all?
Yeah, I said flexion extension. Yeah, full range of motion. Okay, so Sophie, now I believe I'm going on to the back of the neck, correct? The spine. Wait.
Inspect trachea.
Trachea. Okay.
Swallow.
Okay. So Sophie, now I'm going to have you take a sip of water, but don't swallow yet. Go ahead and swallow. Good. So trachea is midline and no swelling. Now I'm going to go around and I am going to check your thyroid gland. So I'm coming behind you. I'm going to put my hands around your neck. Okay, so you're going to
Not too, like, don't fire it's sensitive.
go ahead and swallow. Good. Okay, so I'm feeling her thyroid gland, feeling for the, what's it called? The isthmus and the left and right lobes. Isthmus. No swelling, no nodules, no goiter noted. All right, so next we're going to go on to your back. So here I'm going to be feeling your spinal processes. I'm going to be using this method of palpating, going down the entire spine, feeling for any step-offs or any bony abnormalities. Please let me know if anything hurts. Going all the way down to the bottom. So no step-offs noticed, no pain noted. Now we're going to check the supravertebral. What's it called?
Anterior, posterior?
No. I'm on the posterior, but I'm looking at the paravertebral spine, going down all the way down. Any problems there? Any pain?
No.
Good. So no tenderness noted on the paravertebral spine muscles. Now, Sophie, I'm going to have you take a deep breath in for me. Good. Go ahead and sit forward all the way on the edge of the chair for me. Now I'm going to do, okay, I'm going to have you do it this way so I can. I got to practice this. I'm going to be checking lung expansion. Okay, now just relax. Take a deep breath in and out throughout your mouth. Good. Okay, one more time. Good. Okay, so symmetrical lung expansion for the lungs. That's a little bit out of order, but you should be finding it. All right, so next, Soph, we're going to listen to your lung sound. So every time I touch this to the back of your, onto your back, the bell or the diaphragm, I'm going to have you take a deep breath in and out throughout your mouth. Good. 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 Go. Doing okay?
Yeah.
Okay. Okay, now I'm gonna do the right middle lobe, deep breath in and out. One more time. Good, huh? Good. So lung sounds are clear throughout. The breath sounds are bronchiovesicular, no wheezing, crackles, rails. Now we're gonna go
Right
ahead.
middle lobe is clear to us.
And right middle,
so
yes.
rotation.
Okay, right middle lobe is clear. So now, Soph, we're gonna go on to having, I'm gonna have you breathe same, but I'm gonna be checking your anterior chest. Deep breath in and out. Again. Again. And one more, sweetie. Good. So again, bronchovesicular sounds, clear to auscultation. Breath sounds were equal bilaterally. No rails, crackles, wheezes, rhonchi noted. All right, now, so I'm gonna go ahead and check your heart, I'm gonna listen to your heart. So this, you just breathe normally. So I'm gonna find the second intercostal space on the left,
With my mouth on
or right sternal border. You just breathe normal, just like your normal self. Yeah, just normal. And listening to the aortic, moving over to the left, second intercostal space, listening to pulmonic, going down to the third, fourth, fifth, listening for the left or the right ventricle as well as tricuspids, going over, doing the mitral valve as well as the left ventricle. Okay. So Sophie, the heart rate was at about 72,
So it says
regular.
mitral valve is at the mid-clavicle line.
Oh,
and
yeah, fifth intercostal space. Okay, so when I found the mitral valve, I was at the fifth intercostal space, mid-clavicular, so right under the nipple about. Now I'm going to, okay, so those heart rate was regular. I heard no murmurs. It was 72. Okay. Now I'm going to find your point of maximal impulse, which is right at, again, at the fifth intercostal space, mid-clavicular. Here I'm feeling for it. It's non-displaced, and it's, what's the other way that I have to say that? PMI.
I'm trying to figure out where you're at. Because, okay, heart rate is 72, the rhythm is regular, and each site, a normal S1, S2 is appreciated, no S3, S4 split sounds or friction rubs are identified.
Perfect, so thanks for letting me know that. Okay, so at your heart sounds, your heart rate was at 72. There was no friction rubs, there were normal S1, S2, no S3, S4 or splitting sounds. No murmurs, no friction rubs. Okay, good. So the PMI we also can do when she's laying down. I have to look up in the book the way they want us to do that for sure. But I always forget the PMI, so I had to do it there. So point of maximal impulse, so it was non-displaced and it was less, I think it's like less than 2 centimeters. Right. Okay, what do I have to say? 1 to 2 inches. Okay, yeah, I have to do that there because I forget it. Okay, all right, so now let me get back to where I was at. I listened to your lung sounds, I did that. Okay, Dad, now go back to the other page. And so now, Sophie, we're going to check your breast. So I'm gonna have you place your hands on your hips like this. Here I'm looking for symmetry, size, shape, contour, any dimpling, any orange peel, any retractions of the nipples. Go ahead and place your hands way over your head. Good. Again, looking for symmetry, nipple retraction, orange peel, lumps, size, shape, contour. Okay, go ahead and put your arms down. So I did not see any of those signs. Okay. Now, Sophie, I'm going to have you lay down for me, okay? Emmett's going to have to movie. Am I going to place that? Good. Yeah.
Just like put your head on the pillow for a bit.
Okay, so just lay her down. Okay, so Sophie, here we're going to do a breast exam, and I'm just going to be simulating. I'm going to place your hand over your head like this. With this, I am going to be using a circular motion with my three fingers. I'm going to be starting in the tail of Spence, doing the circular motions, deep or medium or light, medium, and deep, all the way throughout the armpit, going all the way up to the clavicular area, going down the breast, making sure that I'm getting all the tissue. Once I get to the nipple, I'm making sure there's no drainage, going all the way up, again, all the way down. When I get to the sternal border, I'm complete on that side. Go ahead and put your arm down. We're going to put your other arm up. Okay, and again, starting at the tail of Spence, circular movement, light, medium, and deep, light, medium, deep, light, medium, deep, going all the way down, using a horizontal pattern on this. Light, medium, deep, again, looking at the nipple for any drainage, going all the way up to the clavicle. Again, once I get to the sternal border, I'm done with the breast exam. And I was watching her face and I didn't see any, noted pain on her face. Was there any pain? No.
Breast tissue is soft without palpable mass.
Okay.
There's no tenderness. There is no nipple discharge.
Okay, so no nipple discharge, non-palpable masses, non-tender, smooth. Is that correct?
Yeah.
Okay, so now, Sophie, we are going to go ahead and go on. The next thing that I want to do is just straighten out your neck here for me. Go ahead and put your arms down at your side. I'm going to be feeling your carotids one at a time. Good, so I'm feeling for rate, rhythm, amplitude. Okay, so rate is 72, amplitude at 2+, regular and regular bilaterally. Now I'm going to go ahead and listen to your carotids for any bruits. With this, I'm going to be using the bell of my stethoscope. Okay, go ahead.
Please hold your breath and do not speak.
Hold your breath, please. Good. So no bruits noted. All right. So next I'm going to go down, Sophie, and I'm going to be listening to your heart. Here I'm looking for any murmurs. Again, with the bell of my stethoscope, I'm going down to the second intercostal space on the right, and I'm listening for the aortic on the left, second intercostal pulmonic, going on to the third, fourth, and fifth, listening at the tricuspid valve, tricuspid valve, and then going on mid-clavicular, fifth intercostal space, looking, feeling or listening at the mitral valve. And no murmurs noted.
The mitral valve is at the mid-clavicular line in fifth intercostal.
Fifth intercostal space, okay. So now I'm gonna go on, I'm gonna be listening to your aorta and some other arteries for bruits. Good, so renal, the other side on the renal. Now I'm listening to the iliac. Good, so no noted bruits. Now I'm gonna go on to listening to, for any, I'm listening in all four quadrants for your bell tones. Okay, I hear gurgling in all four quadrants and normal active. All right. So
what about precordium?
Oh yes, so here I want to look at your precordium. I'm seeing no heaves in the precordium. Correct?
Heaves or deformities.
No heaves or deformities of the
thorax.
chest. Did I forget to do the AP diameter then? Maybe that comes next. Okay, so here I'm looking at your abdomen, doing an inspection, looking for any audible lumps, looking for any striations, looking for any scars, and I don't see any. So the next thing I'm going to do is I'm going to percuss the 9 regions of your abdomen. Feeling for, hearing or listening for tympany or dullness. Okay, so I heard tympany throughout, a little dullness over the sigmoid colon. All right, so next we're going to go on to palpation. So I'm going to have you bend your knees for this. Pretend like your knees are bent. All right, so I'm going to do light first, which is at about 1 centimeter. Doing all 9 regions of the abdomen, looking at the patient's face to see if she's having any pain or any guarding or facial indication that she's having pain. Now we're going to do deep palpation, which is about 3 centimeters. Again, feeling for any lumps, watching the patient for guarding or any tenderness. I do not, there was no palpable masses in the abdomen, no guarding or tenderness from the patient. Okay, so now we're going to go on to the femoral arteries. Here I'm going to be feeling both sides. I am feeling for rate, rhythm, symmetry, and amplitude. So 2+, that's 72, regular and symmetrical. Now I'm going to feel for inguinal nodes going down. No palpable inguinal nodes again. 1 centimeter, none greater than 1 centimeter. No fixed or hard. All right. So after inguinal, okay. Now, Sophie, I'm going to be inspecting your legs. Here I'm looking for muscle mass and symmetry. I'm looking for hair distribution. I'm going to palpate your hips first. Any pain there? Nope. Okay, I'm going to go to the quadricep, go down all the way to the knee, feeling the patella, going down the shin. Here I am looking for any pitting edema. Also feeling the calf muscle, ankle, and the foot and the toes. Any pain in there? No. All right. So now I'm going to go on to the other side, starting with the quad, going down to the knee, all the way down the shin. Again, no pitting edema, no palpable lumps. Okay, so the legs are symmetrical. The muscle mass is good. The hair distribution is regular, and no palpable abnormalities. Now we're going to go on to some range of motion of your hips. So Sophie, let me do the work on here. This is a passive exercise. So go ahead and just relax. Relax. Okay, I'm going to be bringing your knee up for flexion, and then we're going to extend. And then I'm going to do adduction, abduction. And now I'm going to be checking the hip for external rotation, internal rotation. Now we're going to go on to the other side. I'm going to be getting on the other side of the patient for this. I'm going to do flexion, good, extension, good, okay, flexion, okay, just adduction, abduction, external rotation, internal rotation. So full range of motion of the hips. Now I'm going to go down to the feet.
Hip has full passive range of motion bilaterally.
Okay, hip has full passive range of motion bilaterally. Now I'm going to go on down to your dorsal pedalis pulse. 72, regular, symmetrical, 2+ amplitude. Now I'm going to have you do some exercise with your feet. So this is going to be range of motion, active range of motion. I'm going to have you take your toes and point them up towards your face. So that's dorsal flexion. Point them out this way towards me, plantar flexion. And then I'm going to have you touch your toes together without your heels touched together. That's eversion. And then I'm going to go ahead and have you put the palms together, inversion. Good. So full range of motion of the ankles. All right, full range of motion of the ankles. All right, so now I'm going to have you sit up, and I'm going to have you sit here. Okay, and now we're going to do cerebellar function. Is that correct?
Mm-hmm.
All right, so cerebellar function. So what I'm going to have you do here is put your legs down. I'm gonna have you do the rapid alternating movement. So palms, and then the backs of your hands, palms, back of your hands will go fast, looking for rate, rhythm, symmetry, good, intact cerebellar function. Now,
Neural prop.
yeah, I don't have to say that one.
Okay.
I can't, if I can't say it, I'm not saying that. She said, just say the ones that you feel comfortable with. If I get docked a little bit, it's okay. I just can't do those words. Okay, so now we're gonna do some reflexes. So on this, Sophie, I just need you to be really relaxed for me. The first reflex is the biceps. Good, so 2+ on that. I'm gonna do the brachioradial. Wait, is it brachioradialis? Good, so 2+ on there. Then I'm gonna go on to the brachioradial and then tricep. Oh, good, 2+ on there. Okay, that's all it on the hands. Okay, now we're gonna go on to this side again.
Triceps says 1+.
Okay, 1+. She had 2+ though, okay. So here I'm gonna do the bicep. Put her down.
You guys see bicep reflexes or +2 out of 4 by the
Okay, so +2. Gonna do the brachial radial. Okay, +2 on that, and then we're gonna do the bicep, tricep. Good. 1+ on that side. Yeah, now we're gonna go on to the knee. What's it called? No, don't tell me. What's the knee called again? Plantar. No. Huh?
patellar.
Patellar. God. Okay. Good. 2+. Good. 2+ on that side. Now we're gonna do ankle. Good. 2+.
Achilles.
Okay. Achilles. 2+. So
Achilles tendon.
okay, Achilles tendon. So reflexes. Okay, are all complete. Okay, reflexes. Okay, so now, I'm gonna go ahead and have you stand up. We're gonna inspect your spine. I'm gonna have you turn this way for Mom. I'm gonna be looking at your spine, looking for the curvature of your spine, looking for any scoliosis, lordosis, or kyphosis, scoliosis, or lordosis. I'm gonna go ahead and have you bend forward for flexion, putting your hands down, good, all the way down, as far as you can go. Looking here, no scoliosis noted, looking at the level of the hips. Go ahead and stand up. I'm gonna have you bend all the way back as far as you go, so that's extension, full range of motion there. Now I'm gonna go ahead and have you just twist at your hips from left to right. Good, full range of motion there. And then go ahead and put your hands at your side. I'm gonna have you run your hand down to your knee on the side, one at a time. One at a time down like that, good. And one at a time on the other side down, good. So full range of motion of the hips. All right, Sophie, now full range of motion of the hips. I'm gonna have you turn around for me and face the camera. So now we're gonna do your leg strength. I'm gonna have you stand on one foot, bend your other leg up. I'm gonna have you bend down, good, so full strength. We'll do the other, same thing, good, full strength of the lower leg muscles. Now I'm gonna have you walk. Go ahead and walk forward for me. Good, I'm looking at your gait, I'm looking at your shuffle, I'm looking for any foot drop, I'm looking for any leg lag or wide spaced walking, wide foot walking, which you didn't see. Gonna have you walk on your tiptoes. Here again, just looking at her strength and her balance and her coordination. Come on back on your heels. Good. Now the last thing, I'm gonna have you do this is a tandem walking, heel toe, good. So good balance and perception there, good. All right.
Okay, you said full range of motion of the hips.
Yeah.
It actually says there's full range of motion of the spine.
Oh, the spine, okay. All right, so tandem walking, okay. And Sophie, I believe that is the end of your portion of the exam.
Should I
Is that
stop
right,
the time?
39, so, but no, oh my God, so 39, and then the whole other part is gonna take me,
Less than 1 minute.
Should I press
Yeah.
end live?
So now, no, I still need to, okay, so now we're gonna go on to the male GU and the female GU. So for the male GU, you can go now. Sweetie, thanks. I'm gonna start it up again to see how long. So for the male GU, I'm going to wash my hands, glove up, have the patient standing. I'm gonna be seated. I am going to be inspecting the pubic area, looking for any infestation, rashes, lesions, looking at skin, hair, color. I'm going to be looking at the shaft of the penis. First, I'm going to go ahead and palpate the shaft of the penis, going down to the glands. If he's uncircumcised, I'm going to have him retract. Looking at the urethral meatus, looking for any lesions or drainage. Then I'm going to go on to palpating each of the testes one at a time, so left and right, or right and left, either one. So palpating for any lumps. Then I'm going to go up to the epididymis, feeling that, looking again for any pain or redness, tenderness, going up to the spermatic cord. Again, this is all one at a time, going up the spermatic cord, going to the inguinal ring, inserting my finger near the inguinal ring, have him cough and see if there's any bulge. If there's no bulge, then he's negative for hernia. I'm going to do the same thing, following the spermatic cord up to the inguinal ring, insert my finger, feel for the feeling to see if there's any bulge. When he coughs, none. All right, so now we're going to go on to the rectal exam of the man. So I'm going to stand, I'm going to have him bend over. I'm going to make sure, get permission to do this. If it's okay, then I'm going to go ahead, I'm going to lubricate my index, or my index finger. I'm going to have him bear down. I'm looking at his anus. I'm looking for any hemorrhoids, any fissures. As he's bearing down, I'm going to insert my finger into his rectum. I'm going to rotate it to feel the posterior, anterior, and both lateral surfaces, feeling for any induration, any masses, any hemorrhoids. Then I'm going to go to the anterior area, feel for the sulcus of the prostate and the two lobes. It should be protruding out about 1 centimeter. It should feel like the eraser on a pencil. And it should be non-tender. Then I'm going to go ahead and withdraw my fingers and give him a tissue. So now we're going to go on to the female. The female, again, I'm going to wash my hands, put on my gloves. I'm going to have her get into the lithotomy position. I'm going to place a drape over her so that I can see her face. I am going to be telling her when I touch her, and again, getting permission to do this. The first thing that I'm going to do is I'm just going to be inspecting. I'm looking at the mons pubis, looking at the hair distribution. I'm looking for any lesions, rashes, warts. Going down, looking at the labia minor, or the labia major, labia minor, the urethra, the clitoris, the rectum, the interosseous. That's probably about on almost the last page, second to the last page. All right, so looking at the interosseous and just seeing if there's anything abnormal. Then I'm going to be taking my speculum that's been soaking in water. I'm going to add a little bit of lubrication. I'm going to let the patient know that I'm touching them. I'm going to insert my finger on the posterior wall of the vagina, adding a little pressure. I'm going to insert the speculum in a downward motion at a 45-degree angle. Once it gets all the way in, I'm going to rotate it horizontally. I then am going to go ahead and open it slightly to see if I can see the cervix. If I can, I'm going to retract it slightly, close it, reposition it. Once I find the os and the cervix, I'm going to go ahead and inspect. I'm looking for any bleeding, any rashes, any redness, any abnormalities. Also looking at the wall of the vagina for the same thing. Once that's done, I'm going to go ahead and slightly pull out the speculum, getting past the cervix, unlocking it, closing it with a downward pressure, removing it. Then I'm going to tell the patient that I'm going to be doing the bimanual exam. So I'm going to be taking off my left glove. I'm going to be lubricating my index and my middle finger. Here I'm going to place my non-gloved hand on her abdomen, and then I'm going to insert, telling her that I'm going to insert my fingers into her vagina. I'm feeling for the cervix, feeling for any tenderness, seeing if it's firm, fixed, watching the patient to see if she's having any discomfort. I'm going to be palpating the sides of the vagina, looking for any masses, any lesions, if I can feel any lumps. Once I'm done with that, I'm going to rotate my hands to the right, and I'm using my hand on the lateral side of the abdomen, I'm gonna be using a scooping motion or sweeping motion, trying to capturing the ovary, which should be about the size of a almond, it should be non-tender, but then she might have a twinge when I capture it. Then I'm feeling for any nodules or any tenderness. I'm gonna go onto the other side, rotating my hand, going to the left, again, doing the same thing, using a sweeping motion, feeling for the ovary, should again be about the size of an almond. It should be, there should be no nodules, it should be non-tender, and it should not be fixed. And once I'm done with that, then I'm gonna remove my fingers from the vagina and the exam is complete. 45 minutes.
Palpate uterus bimanually, did you do that?
Yeah.
Okay, you're going so fast, Vivian.
I know,
I'm not
because
sure.
look at me, I'm like, I need 6 minutes to talk about all this crap.
Yeah, so, while you're going through the exam, do you have to say, next I'm gonna be examining this? And then
Mhm.
you do?
I'm supposed to. The best I can. You know what, at this point, like every time I wanna add a little more and a little more, but like, some of it, like the really big difficult words, look at me, I forgot patella. I couldn't even remember the name of the fucking patella. So like I get caught up on all this terminology.
Mhm.
And that's fine, I know I'm gonna get some points off for that, but the main thing is that I don't want to miss any of the major steps. Do you feel like I missed anything?
No, I mean, just some terms or, you
Yeah.
know, bilaterally, you know.
Yeah.
But overall, I mean, from what I could tell, it's good.
Okay, so,
You got all the main points.
yeah, that's the big thing is that, the main points, because they don't tell us how much things are worth.
Yeah,
Like, so that's kind of, you know, and like honestly, Kelsey, she was like so calm and just talking and she was not rushed. Like, I feel like I'm just freaking rushed.
yeah, are you like saying extra things?
I'm not trying not.
And you have to say, next I'm going to do this.
You
for
have
the
to tell them
patient."
what you're doing.
Tell who? The patient?
Well, yes, you're telling the patient and you're telling the instructor. Because like when you go in for a physical exam, let's say you go in and all of a sudden the provider tells you to lay down here and they start rubbing your breast, or they go to inspect your penis and they start rubbing it, like you have to tell them what you're doing.
Yeah,
Oh shit, I gotta shut this off.
upper extremities, nails and fingers.
I did those.
Fingers.